To start the quadriceps sets, place a small towel roll under your involved knee. Sit with your legs straight out in front of you with your arms propped behind you. Contract your thigh muscles, straightening your knees fully, and hold for a slow count of 3. Then relax. The side-lying adduction begins by lying on your involved side with your knee straight. Bend the top leg and place your foot on the ground in front of your bottom leg. Raise your bottom leg up a few inches off the ground, making sure that you raise your leg straight up and not forward or back, while keeping your body facing forward. Keep your foot facing forward throughout the movement. This movement should be performed slowly and without pain. You may add an ankle weight around your knee or ankle for more resistance. To begin the full functional squat with a chair, sit in a chair and scoot toward the edge of the chair. Place feet on the floor hip-width apart, feet facing forward or slightly toed out. Move your nose out toward your toes and stand up fully without locking your knees out completely. Lower back down, barely touching the chair, and stand back up. Maintain knee alignment, avoiding inward movement of your knees. To start the SLS, or standing limb stance, begin standing next to a chair or counter, gently touching the chair or counter for balance. Shift your weight onto involved leg. Once you feel comfortable, try to completely let go of the chair or counter and hold your balance for the time recommended by your therapist. Repeat on the opposite leg. You may have some loss of balance with this exercise, so it's important to have a chair or counter to assist as needed. As you get better, you'll be able to push yourself to hold your balance without reaching for support. Similar to the single limb stance, balancing with your eyes open, now take away your visual input. Standing next to a chair or counter, gently touching the chair or counter for balance, shift your weight onto the involved leg. Once you feel comfortable, close your eyes. Once adjusted to the lack of visual input, try to let go with your hand as well. It's important not to do this exercise if you are feeling dizzy or if you have a lot of difficulty letting go with your hand once your eyes are closed. If you're having difficulty with this exercise with your eyes closed, but not when your eyes are open, please let your physical therapist know. Start the full lunge lateral by standing at a counter or holding onto the back of a chair. Step out to the side with your affected side approximately 3 to 4 feet. Bend your knee to about 90 degrees, sitting back with your buttocks, not allowing your knee to pass over your toes. It's important to keep your back straight with a slight bend at your hips to maintain balance. Keep the uninvolved knee straight and maintain your feet facing forward so that your toes and heels are parallel with each other. Start your bridges by lying on your back with your knees bent hip-width apart and your feet flat on the floor. Place your hands beside you with palms down and raise your buttocks up off the floor while pressing your arms into the floor. It's important to push up using your buttocks muscles, not just pushing yourself up by trying to straighten your knees. If your feet are sliding, you are likely making this mistake. Begin this straight leg raise by sitting with your hands behind you to prop you up. Place your uninvolved leg in a bent position with your foot flat on the floor. Straighten your involved knee completely and maintain a straight knee as you raise your leg until it is parallel with your other thigh. Keep your core engaged by pulling your belly button toward your spine. You may feel the muscles at the front of your hip working. This movement should be performed slowly and without pain. You may add an ankle weight around your knee or ankle for more resistance. This straight leg hip abduction starts with you lying on your uninvolved side with your knees bent to 90 degrees. Support your head with a small pillow or rolled towel and your bottom arm. Straighten top leg completely and raise leg up away from bottom leg to approximately 45 degrees, keeping your leg in line with your body. Turn your foot down, rotating your hip inward so that your toes are facing more toward the floor. A common mistake during this exercise is to roll backward and lift up with the top of your leg instead of the muscles on the side of your hip. This exercise should be performed slowly and without pain. You may add an ankle weight around your knee or ankle for more resistance. Begin the prone hip extension by lying on your stomach and engaging your core by pulling your belly button towards your spine. Bend your involved knee 90 degrees and raise your involved leg until your thigh is off the floor. Pause at the top of the movement and lower your leg slowly back to the floor. You may add an ankle weight on your ankle for more resistance. Avoid arching your back when you raise your leg off the floor. To start the hip excursion, place a chair on one side of you with a second chair or table on the opposite side. While standing with your feet shoulder-width apart, shift your weight to the right, pushing your hip as far out toward the chair or table as you can without losing your balance. Repeat, moving toward your left. It's important to shift your weight through your hips, moving your belly button over the foot that you are moving toward, while not leading with your shoulders. To begin the standing hip flexion, stand with your feet hip-width apart and hold on to the back of a chair for balance. Stand with your uninvolved leg with a small hardback book under your foot. Slowly raise your involved leg out to the front while keeping your knees straight. Pause at the end and lower your leg slowly back to the starting position. Maintain your upright posture with a straight back and your core engaged throughout the exercise. You will feel some muscle fatigue in the leg you are standing on, as well as on the leg that is moving. Take a break if needed. Begin this exercise by standing with your feet hip-width apart and hold on to the back of a chair for balance. Stand on your uninvolved leg with a small hardback book under your foot and slowly raise your involved leg out to the back while keeping your knees straight. Pause at the end and slowly lower your leg back to the starting position. Maintain your upright posture with a straight back and your core engaged while avoiding bending forward at your waist. You will feel some muscle fatigue in the leg you are standing on, as well as the leg that is moving. Take a break if needed. The standing hip abduction starts with your feet hip-width apart. Hold onto the back of a chair for balance and stand on your uninvolved leg with a small hardback book under your foot. Slowly raise your involved leg out to the side while keeping your knee straight and your foot facing forward. Pause at the end and lower your leg slowly back to the starting position. Maintain your upright posture with a straight back and your core engaged without leaning to the side throughout the exercise. You'll feel some muscle fatigue in the leg you are standing on, as well as the leg that is moving. Take a break if needed. The standing hip adduction starts with your feet hip-width apart. Hold on to the back of a chair for balance and stand on uninvolved leg with a small hardback book under your foot. Slowly raise your involved leg in front of your stance leg, leading with your heel, while keeping your knees straight. Pause at the end and slowly return your leg back to the starting position. Maintain your upright posture with a straight back and your core engaged throughout the exercise. You will feel some muscle fatigue in the leg you are standing on, as well as the leg that is moving. Take a break if needed.